Right, so here we are today talking about a really important dynamic stability or dynamic balance test and exercise that we use with our patients quite a lot when we're dealing with balance issues or control issues of the lower limb, be it the ankle, knee or hip. So this is called the Star Excursion Test or the Star Excursion exercise, and in the clinic we'll use it to test dynamic stability. At home we might give you this as an exercise, if applicable, to do as a way of improving your dynamic stability if you've had an injury to your ankle, knee, hip, etc. So the way it's set up here is we get some tape and put it along the floor running forwards, and we've got another piece running at a 45 angle this way and a 45 angle that way. Centimetre points are marked along the tape. I usually start at about 50 centimetres because this is going to be pretty much dead space. Most people will sort of hopefully push up past that. So I usually start about 40 or 50 centimetres and then measure 1 centimetre increments that way, and the same going back on both these two lines here. So the exercise and or the test is done by standing on the midpoint like that, and the aim is to see how far you can get forwards, and the idea is to not plant the leg. The idea is to just touch the toes and then come off. So the attempt doesn't count if you've actually planted your foot. The attempt only counts if you've just touched. The same thing applies for the anteromedial line. You can only just touch. If you lose stability and fall, that doesn't count. And if you plant the foot, as I said, that doesn't count either. It's just got to be a touch of the toes. And that's the anterolateral one across the back. So I'm obviously testing my right leg, the balance leg at the moment. And the score we take for this is the centimetre at which you have achieved, the further centimetre you have achieved going forwards, anterolaterally and anteromedially. And we usually give the patients 3 attempts and we take the best of the 3. So there is also other measurements we can do where we add the 3 together and then compare to the other side and see if it's within similar sort of a similar difference between left versus right. So we use it as an objective measure when it's return to sport time, and we also use it as an exercise to help develop dynamic stability. So hopefully you find it useful, and be guided by your physiotherapist in terms of when to use it and how to use it.